But the vaccine is here. We're distributing it. That's good news. And I want to talk about that here this afternoon. We were able to move so quickly within that 2-hour time frame after receiving the vaccines because of these partners here and the work we've been doing since October. As you kind of will soon hear, much of our planning has been in partnership with many key healthcare groups in the community and other partners who are helping to make the vaccine distribution a successful reality for Polk County residents and those who work in our community. I would like to stress how fortunate we are to have the support of these community partners. This doesn't happen everywhere, so we are very lucky to be in this community. And none of this would have been accomplished to date without these folks and their organizations. They have provided both time, personnel, support to move this vaccine from the fridge to the arm, or what we're calling the last mile. Special thanks to St. Luke's and Tryon International Equestrian Center for opening their doors to our points of dispensing, our vaccine clinics, or pods. We could not have gotten as much vaccine out as we did without that happening. So again, on December 22nd, St. Luke's hosted a mini pod where we vaccinated just under 100 people in 4 hours. Tryon International Equestrian Center let us use their covered arena the following Wednesday, and we were able to schedule me back there next week. And right now, next Wednesday, which is our phase 1B group 1, which is 75 and older, we have 400 persons scheduled for that vaccine clinic in roughly 6 hours. So, and we also went out to the pavilion and worked with their folks there as well. And other long-term care facilities are being serviced by Walgreens or CVS this time. But there are a few in the county that are not, and we are partnering with those facilities to bring the vaccine to them. I would also like to make two additional recognitions if I could. Since the beginning of this pandemic, we've had a number of volunteers answering phone calls and helping to provide educational materials to the community. Our Health and Human Services Board members have been supporting this effort and volunteering their time, from retired and still licensed nurses to some of the still full-time employed board members who are finding time to make calls to the community members. So we thank them greatly for helping us get through this process over the past 10 months. I'd also like to thank the families of the teams that I listed here. Their response to healthcare workers, the first responders, the additional staff, they have shared, those families shared their loved ones with the community so we can continue to help those in need. And I think it's important to know that when staff are in the hospital for 12, 15 hours, or we got our call staff calling folks late in the night, there are families at home that are still operating while those folks are away. So we want to thank them for sharing their time with us. So we also want to cover some key definitions in this process, because there's a lot of big terms out there that are new to the public and could be scary. We want to just put those myths and concerns to rest. Emergency use authorization, which is defined outlined here by the Food and Drug Administration, is a mechanism by which the FDA commissioner may allow unapproved medical products or unapproved uses of approved medical products to be used in an emergency to diagnose, treat, prevent serious or life-threatening diseases or conditions caused by, in this case, a biological threat to the public, when no other adequate or approved or available alternatives are available. What it does not mean is that corners were cut, safety protocols were not met, and people are being placed in harm's way. It's quite the opposite. Per the CDC, messenger ribonucleic acid, or mRNA, vaccines are a new type of vaccine to protect against infectious disease. They trigger an immune response. However, many vaccines put weakened or inactivated germs into our bodies. This is not the case with the COVID vaccines that we've received to date. Dr. David Wall, who recently presented at UNC's town hall, likened the mRNA to text messages or Snapchat. Our cells receive this message, they act on it, making some of the spike proteins, which we'll talk about here in a second, and then it goes away. So by teaching our cells to make that protein, or even just a piece of the protein, that process triggers that immune response inside our bodies. And that immune response, which produces antibodies, is what protects us should the real virus enter our bodies. Uptake refers to how many vaccines were administered per location per day to match the supply and demand. So last week, in our first week, we distributed 265 vaccines out of the 1,500 doses that we received. It's about 18%. We are scheduled to distribute about 35% of our allotment by next Wednesday. So in other words, are we reaching enough people with the vaccine in a timely fashion to build that adequate herd immunity via a vaccine? Efficacy is the ability to produce a desired or intended result. In short, is it effective at preventing symptoms or other negative outcomes? So local health departments and hospitals received initial information on the CDC's plan for vaccine distribution starting in September. Today's conversation will cover the highlights of this plan, current planning efforts, and what to expect in the immediate future. As you can imagine, the information we've been getting comes in rather large bursts in very short notice. So we've been drinking out of a fire hydrant, if you will, over the past 2 months in preparation, but it's well worth it. We are eager to deploy the resources we have to get the vaccine distributed effectively as possible and efficiently as possible. So we've been working under what the federal vaccine operation has been coined Operation Warp Speed, which is continuing to engage with state and local, tribal and territorial and local partners, other stakeholders, and public to communicate public health information before and after distribution begins and around the vaccine to promote vaccine confidence and uptake. It is also designed to distribute vaccines immediately upon granting of emergency use authorization. So we started this planning process way back in October, outlining how we're going to get it out, how we're going to identify folks who are eligible, how we're going to get it from the fridge to the arm. Also ensuring safe administration of the vaccine and availability of administration supplies as well. Lastly, to monitor necessary data from vaccination program through information technology. So both vaccines that we currently have available in the United States, Pfizer and the Moderna, are 2-dose vaccines. If you think it's a logistical challenge to get 1 dose out, try getting 2 doses out in a short period of time and getting those folks back. So there's a rather robust IT process in place that doesn't necessarily link with our existing IT process, that there are some human beings on the back end making that all work, courtesy of my team. So, but yeah, so IT is a big proponent of a piece of this process. So there are 4 key goals to the operation, which include ensuring safety and effectiveness to reduce morbidity of COVID-19, support rapid vaccine distribution, and to assist with a return to pre-pandemic quality of life. All guided with some tenets, which are control and visibility by the CDC, the FDA, all the way down to the local level, coverage, traceability, and uptake. The tenets all refer to some level of operational awareness pre and post vaccine. So those things are outlined in our plan and how we're monitoring it and how we're tracking it. As you can imagine, there are 3,200 people that have responded to our interest survey. It's a lot of folks that we're managing their requests. And so we're linking all that through this matrix of protocols that we've developed over the past 2 months. And as you can see from this flow map, the sheer logistics to ramp up testing, production, and distribution of a vaccine is quite the enormous feat. To help with the community absorption of this Herculean effort, the CDC will be using a phased plan, which many of you probably heard about now. That phased plan was a model that then the states had to ratify, if you will, and develop their own phased distribution plan at the state level, which we're now working under. Each aspect of the vaccine distribution is critical to a timely and effective recovery in our community, and this is kind of that timeline. I've highlighted again the data portion here on this infographic because this is a significant portion of what we're trying to monitor and track over the course of the next 2 to 3 months as we go into second doses. Again, as mentioned, the CDC is working off a 3-phase plan for distribution. I anticipate for us to work through the North Carolina plan, it's going to take some time. Again, we're currently in phase 1B, group 1, which is adults 75 years of older. That's group 1 for phase 1B. And then phase 1A, which are the healthcare workers and volunteers and long-term care employees, residents, and volunteers at those sites. So Pfizer was received on the 14th of December in North Carolina, and on the 21st, Moderna was received here in the state, and within 24 hours, we received our vaccine dosages on the 22nd. This prioritization framework has been revised once already, and it may be revised again as we get through the process, and it's all being dictated by supply at this time. In preparation for this phase plan, Polk County Health and Human Services, St. Luke's Hospital, and FQHCs, which ours is Blue Ridge Health, We're asked to estimate phase 1A totals for Polk County and the counties in which they operate, those FQHCs. And this information was sent to the CDC in October with our application for vaccine. And North Carolina is currently again in phase 1A and phase 1B, group 1, and that's all outlined on the North Carolina website. So I mentioned there's well over 3,000 inquiries for vaccine, and our vaccine coalition, those partners I mentioned at the beginning, developed this online survey to start collecting the information on the get-go. We did not want vaccines sitting on the shelf when it arrived. We wanted to be able to get it out to the folks who are eligible as quickly as possible. So we've been working off of this interest survey of folks who have identified themselves as healthcare workers and now folks who are 75 years of age and older since about late November. And about every day we add about 100 to 200 more folks to the interest survey. So we're a little bit ahead of the game from the other counties, which is great. And I think it's very helpful because we can quickly identify folks and sign them up for their clinics. I suspect as more providers come online towards the spring of 2021, we will be able to diversify our offerings of access points in the community. But for the time being, it's basically just the hospital and the health department who have access to the vaccine. And so we are coordinating our efforts together to get that out. So again, lucky to have such a strong partner such as St. Luke's. Part of the discussion today is to cover how the process for the two leading vaccines came to development and deployment in such a short period of time. And I want to dispel some myths and correct any misinformation out there too regarding vaccines at this time. First, it's important to stress that neither of the two leading vaccines, both Pfizer or Moderna, cut any corners to achieve such a timely turnaround. Most, if not all, vaccines go through a similar process as to what is displayed here. There's a preclinical process, formulation and animal trials. There's a phase 1, which is small human groups, a phase 2, a larger set of human trials, a phase 3, which is even larger. And both these vaccines had somewhere between 30 to 40,000 people in their third phase. And then there's an emergency use authorization, which we're currently in, or a phase 4, which is licensing. So while the process is generally pretty linear, through these developmental stages, the manufacturers used technology, enhanced global collaboration, and innovative solutions to save time. Moderna, for example, overlapped data collection and next phase planning to help decrease time between the phases. Manufacturers like Moderna were also able to build on existing knowledge and technology in the development process. Still, the FDA's development and licensure of vaccines to prevent COVID-19 industry guidance publication states that manufacturers were still required to meet all regulatory and statutory requirements that normally come along with vaccine development. In addition, the use of mRNA technology meant that manufacturers did not have to grow virus, which can be an extremely time-consuming endeavor. So let's briefly discuss quickly what the mRNA process looks like. So according to the CDC, COVID-19 mRNA vaccines give instructions to our cells to make a harmless piece of what is called the spike protein, and that's this little red thing here on the screen, which is found on the surface of the virus that causes COVID-19. The piece we are focusing on, again, is this S protein, and it basically attaches to your cell to help inject the virus information into that cell. So the mRNA vaccines are given in the upper arm muscle, and once the instructions enter the muscle cells, the cells use that information from the mRNA to make the protein piece. After that protein piece is made, the cell breaks down the instructions and gets rid of them. Next, the cell displays the protein piece on the surface of the cell. Our immune system recognizes that protein, does it belong there, and begin building that immune response and making antibodies, like what happens in any natural infection against COVID-19. At the end of the process, our bodies have learned how to protect against future infection. The benefit of mRNA vaccines, like all vaccines, is those vaccinated gain the protection without ever having to risk the serious consequences of getting sick from COVID-19. Important facts for these types of vaccines: mRNA cannot give someone COVID-19. mRNA vaccines do not use a live virus that causes COVID-19. They do not affect or interact with our DNA in any way. And mRNA never enters the nucleus of the cell, which is where our DNA genetic material is kept. The cell breaks down and gets rid of the mRNA soon after it's finished using the instructions. As I mentioned, there are two manufacturers at this time with emergency use authorization in the United States. That's Pfizer in partnership with BioNTech and Moderna. both using mRNA technology to train the body to fight the virus. Often we are asked, this seems to happen too fast, and is it safe? Again, both manufacturers are required to maintain those adherence to FDA and industry standards for safety and efficacy of the vaccine. In addition, both manufacturers again benefited from a head start of over a decade of prior mRNA research and development. For Pfizer, what helped with their expedited nature was the use of advanced technology to track the data. They actually had 4 trials of their vaccine candidate running in parallel before they moved into the human trials, and they used technology to quickly assess which one was the leading candidate and selected it and moved quicker that way. Moderna also reported that they maintained industry safety standards, but were also enabled to move more swiftly due to their approach of data assessment. They began planning the following phases in the interim as data became available. As an example, on May the 18th, they issued an interim data on phase 1 and began planning and amending phase 2 plans. And on May the 29th, moved into phase 2 while announcing they would soon publish phase 1 data in a peer-reviewed clinical journal. A process or processes, if you think about it, can be sometimes rather linear and take years. In addition, both manufacturers specific approaches that led to shortened timelines. The pandemic provided an opportunity for increased collaboration across the globe, and scientists were able to work together to find solutions in a much quicker manner than they normally would. Another aspect leading to quicker delivery was the initial start of mass production. So they started producing the vaccine as they saw it was a benefit to the folks that were in the trials. So. Sorry, I backed up a little bit too far. I want to talk briefly about the Polk County's current state of operation. So again, in September, local health departments and hospitals were contacted by North Carolina DPH to begin the process of planning for vaccine distribution, which we did. And we brought in more partners as the months and weeks went on, and those partners are listed on our plan. We anticipate by spring of 2021, local pharmacies and other healthcare providers will have access to the vaccine, so that'll help greatly with the distribution process. But again, for the time being, it'll be difficult for us to move through those phases by the state. So we are setting up clinics as fast as we can to reach the populations that are currently eligible. There are some unique differences between the 2 vaccines. Pfizer is an ultra low cold storage, negative 85 degrees Celsius with 2 doses that are 21 days apart. They also require mixing, so you actually have to use a diluent to distribute that vaccine. Whereas Moderna is a little bit more user friendly in terms of the administration side of it. Cold storage, its shelf life is a little bit longer in a refrigerator, and it's 2 doses, which are 28 days apart. In addition, both vaccines had really good safety reports out of their trials. So for example, Pfizer had a 95.6% effectiveness for those 16 to 55 and greater than 55, 93.7% effectiveness. In comparison, your annual flu vaccine, which is likely developed to match 4 different strains of the virus, its efficacy is roughly in the high 30s to low 60s, according to the CDC. So to have a 95% efficacy rate is pretty significant in terms of protection. In addition, both Pfizer and Moderna reported side effects, your typical injection site reactions, sore arm, thing you normally get with a flu shot, fatigue, headache, et cetera. And most of these were reported as mild to moderate, with only severe adverse reactions occurring in 0 to 4.6% of the participants. What was not specifically studied in either one of the trials was children in less than 16 years of age for Pfizer, 18 and less for Moderna. Those folks who are pregnant or lactating, that wasn't specifically studied, and those folks who are immunocompromised. It's not to say that these folks can't have access to the vaccine, it's just that it wasn't studied, and therefore there's no recommendations at this time. Again, overall safety process was followed on both of these. Again, similar side effects for Moderna that were distributed. So again, we've distributed 265 vaccines. We've received, as of before Monday, 1,500 doses. We are in the process of scheduling for next week. We're going to try and get out to about 1,000 people the week after that. And well over 3,000 folks have signed up on our interest survey. So we have a lot to do over the course of the next 30 to 60 days. But our team is ready. They're a little tired.
Thank you.
Pushing them kind of hard, but we're going to get it done. Any questions? That was a lot of information. I do apologize.
That was a lot of information. Oh, Stan, you never ask a question. Stan is up first. You may unmute yourself, sir.
First of all, Mr. Kennedy, you should be commended for the tremendous job you all have done. I live in South Carolina, and I don't think they've done anything yet. But it's amazing because I do fall in that 1B phase 1 category. So I'm excited. I'm a weekly volunteer at Thermal Belt, so hopefully I can sneak in there at some point. Which, do you have both vaccines, or which one are you primarily using? Or
So the state distributed the Pfizer vaccine to locations that could handle the ultra low cold storage capacity piece, and we do not have an ultra low cold freezer, which
Okay.
require us to use nitrogen or special ice, and we don't have access to that either. There was a
Right.
short nationwide. So we have Moderna, which, to be honest with you, I'm more grateful for from the logistics side, because to try and mix the vaccine at a mass distribution pod would have been a lot more manpower.
I'm sure.
Hmm.
Speaking of people who never ask questions, Mary Prelo has her hand up. Mary, go ahead.
Hey, Josh, I just
Mary?
absolutely want to commend y'all for the phenomenal job you're doing. And I have two questions. One is regarding the vaccine and the other is the spread. The first one regarding the vaccine, a friend of mine that's on blood thinners was told was disqualified through the, I guess, the second phase of the survey. But she is trying to get a hold of a form that her doctor can sign waiving the disqualification. Where does she find that form? She said there's one she found after a lot of searching online at the health department, but you can't download it.
She just needs to get a note from her doctor saying it's okay to get an injection. And the reason why we put that on there is we're going to be at a mass vaccination site, and we want to make sure that healthcare providers who are prescribing a blood thinner, for example, are okay with that person getting an injection. They know their bodies, they know their clotting ability, that type of thing.
So she doesn't have to use the form.
No, we just need a doctor's note saying it's okay.
Okay, and one other question about the spread. With the governor's order that doesn't recommend but requires all food service personnel to wear masks, is the health department inspector not going to enforce that, or it's just confusing to me?
So enforcement of the governor's orders fall to local law enforcement. We will receive the complaints and we will go out and educate and remind them of the governor's orders. But when it comes to the penalties attached to those governor's orders, it's up to law enforcement to go out there and to proceed. I tell you the same thing. You got to make choices about where you want to go, where you feel safe, and it's that should be your decision maker.
Yeah,
Okay, thanks.
very good. Lynn Parsons.
Hi.
Hi,
Again,
Lynn.
congratulations on the job you've done, Joshua. So the questions for me is I'm signed up for next Wednesday for the inoculation because of my age. Can we be sure that the second dose is ready? I'm concerned that if I take the first dose, can I definitely get the second dose?
Yeah, the the feds are holding back the second dose for us, so it'll be there. That will not be a
Okay.
problem. And I appreciate the accolades, but it was really a team effort. Our team's working hard, but so are all the partners. And if you look somewhere on the screen, I think Linda Greensfelder is here. She has been working hard on the phones to sign folks up who don't have access to the internet. So she's one of our many volunteers, and we appreciate her as well.
Linda is
That's
one of our
great.
Kiwanis heroes for sure.
Yes. And can you explain simply to me why it takes 2 doses?
Yeah, so when they were looking at the efficacy, so your body's getting that first injection, and your body's reacting to that new activity in your body, and so you're training it, if you will, and then that second dose is the fine tuning.
Gotcha. Thank you so much.
Josh, are the two doses exactly the same thing?
Yep, 0.5 mils of both, at least for the Moderna. Yeah.
It's kind of like working out, isn't it? So I mean, like the first time that you lift weights, your muscles get a little bit sore, but the next time you lift weights, that's where you start to gain a little extra strength, right?
Yes. Yes.
Hmm.
I haven't
Other
worked out in a long
questions?
time since I've been doing this.
Bill McCall. Unmute yourself there, Dr. McCall. You're still muted.
There
you
we are. Okay. My friend Ray McLeese is here with me, and Ray has a
Hey, Ray.
question.
Yeah, hey, Josh, are you a nephew of Diane Kennedy, who was my wife?
Maybe somewhere along the train of the tree. A lot of Kennedys out there.
Right. Okay. So you're not Diane's nephew.
Not that I'm aware of, but the Kennedys are very prolific.
Okay. Thank you.
Okay.
Other questions? Sharon, and then Eric.
Hey, Josh, my question is, and I don't know if you can reveal this, but where are the vaccines stored and how are they stored? I know they have to be cold, but I know you don't have the freezers for the Pfizer vaccine, but still these have to be kept at a certain temperature. So I'm just curious about that.
We actually have an underground bunker in the middle of Columbus. No, I'm just kidding. We have a standard vaccine fridge where they're stored. We have both a freezer and a fridge. So we have a stock that are in the freezer ready to go. We'll probably be thawing those out next week. And then we have a good stock that we can work off for the time being.
Standard vaccine fridge. That's not something that that's not a term that you hear every day necessarily.
Right. Yeah. It's a pharmaceutical grade refrigerator. Your standard fridge has a lot of fluctuations in terms of cold and temperatures within the fridge. And so this is designed to help reduce those fluctuations, although you still have to put water bottles in there and just maintain that temperature and consistency throughout.
Eric.
2 questions, and thank you for everything, Josh. I think you're a great civil servant, and I hope when this is all over, you're properly recognized. I know from my standpoint, you've been great for us here at Cooper Reese. Many times in meetings, I said, well, let me call Josh. And so you get those Sunday texts. Number one, will this PowerPoint or this presentation be available as a handout? Because I'd like to send it to families.
Yeah, it's on a Prezi. I have to find a way to download it into a PDF, but yeah.
Okay. And secondly, have you heard any talk, or is there any talk about diluting the second dose in order to make it go longer?
Yes, I think there were some news reports out of the UK. They were looking at ways to take their existing supply and stretch it out. That's not, at this time, it's not the discussion on our end that we're aware of. And partly because you're working under emergency use authorization. The studies were done under X circumstances and with X outcomes and X expectations. So I don't know if they'll change that at this time.
Okay, thank you.
Sure.
All right, we've got some questions in the chat here too. So let me get to a couple of those. I think you've already answered this. Mary Ann had a question about the second dose. Will it be coming or using the current supply, but it sounds like that's a second dose that is being held back and is going to be coming. Is that right?
Correct.
And also the percentage of healthcare workers here in Polk County who have either not taken it yet or have declined to take it.
That's gonna be tough to figure out on the decline. I can tell you, like I said, we did 100 of our 1A population, with, well, 150-ish, if memory's correct, those first 2 days in that 1A population. And we've done a number since then. But to tell you how many haven't received it yet, I can't pull it off the top of my head right this second.
Okay. And one last question from the chat. Can the phases be accelerated if people who are in the earlier groups don't schedule to be vaccinated? Or if that makes sense.
Sure, it does. And just to back on the initial question, so when we launched the survey, we asked if you worked or lived in Polk County. And the difficulty with giving you a census, if you will, is because we have a number of folks who work here but don't live here. We are not concerned about your residency status. We want to make sure that you're getting vaccinated, which dovetails into the answer to the next question. We have a system in place, we've got a process in place, and we have also encouraged our neighboring counties, if they have anybody in 1A or 1B group 1, they want to send our way, that's fine too. And that's partly because if you think about it, half our workforce goes to these surrounding counties to work, and half our workforce comes from those counties to work here in Polk County. We're public health, and so we are, our goal is to increase public health across the area, not just Polk County, recognizing that people move around, and we want everyone to be safe as they're moving around. So we will have a number of folks who live in Henderson or Rutherford who work here that we will vaccinate.
All right. Linda Greensfelder.
Yes. Josh, would you talk a little bit about the effort to get the word out in the community about the availability of the vaccine and that people can opt in to take it? You know, I think it's important that we do everything we can to spread the word. So it would be helpful to just share what's happening so far.
Yeah, absolutely. So you can imagine we're in a rural community with limited access to the internet or other fast-moving media pieces. So we are using Nixle, we are using the internet, we're using word of mouth. I'm doing these speaking engagements so that we can do that person-to-person communication. We're hitting up our networks, such as the firefighters. I'm trying to get up with our pastoral networks to let them know, all in an effort to help spread the word that we would encourage everyone to tell us they're interested, either go online if they can, and if they can't, they can call the message line and we will call them and connect with them. But like you said, it's a difficult challenge in a rural community, and we're looking at other alternatives such as postcards and other things to get folks in the door so they know that vaccine's available, and if they're eligible, to go ahead and get that vaccination process started.
All right, Stan. You're still muted, Stan.
Yes.
You're still muted there. One.
Is this form the best way to get into the queue?
Either way is fine, or you can call the line. Just know that we are getting an abundance of phone calls, and you may take a while for us to get back to you.
Well, and I called yesterday and got right through to the recording, so that was really good, Josh.
I filled out the survey online. Do you want to give us the phone number and the web address so that I can type it into the chat for everybody?
Yeah, I don't have the message line on top of my head.
Okay.
You can also go to the Polk County website, polknc.org, and go to the COVID-19 section, and that'll have the message line as well. And the line is 828 722-5086. Again, that's 828-722-5086.
Okay, I got that. That'll be in the chat in just a minute, everybody.
Now that I've just indicated the telephone line with phone calls.
Okay, there's that. Hold on just a second.
Clear.
All right, so that is now in the chat. Any other questions? Yes, Mary Sasser, you are not muted, so you can go ahead.
I was wondering, I filled out the survey and have gotten some phone calls on it, but I live at Tryon Estates and I wasn't sure if I ought to wait until they're doing it at Tryon Estates.
Either one's fine. You know, if you wait to the Tryon Estates, that's great because they're getting their own distribution from, I think, CVS. And that will give that other dose for somebody out in the community.
Okay, so I guess I need to let them know that I'm not, all right, I'll follow up on this then. Thank you.
Sure.
You can read that. COVID vaccine.
Very good. Any other questions? We've got any other questions? I had a quick question, Josh, and that is, earlier you said, you know, there are things that we can do right now, even without getting the vaccine, to both protect ourselves and protect those around us in the community. And one of those things that you said, obviously, was don't gather with other people. Now, gathering with other people can mean getting together with a friend, or it can mean getting together with 15 people. What kind of refine that term of gathering, if you don't mind? Because some people are really, I mean, really strict about not, you know, coming in contact with other people right now as much as possible.
Right.
And others are much more less strict about that. So go ahead.
Yeah, the level of community spread out there is pretty significant right now. So we're seeing a lot of folks who are household, you know, household A and household B are coming together, and that is where we're seeing a lot of that transmission occurring. You know, risk is a spectrum. I can never tell you zero risk short of staying in your house and never doing anything, but then you got to eat, so you got to get groceries, so you're gonna have to go out. So you know, going to a concert with 50,000 people, bad idea.
That is
Staying
definitely
home,
gathering.
yes, that's definitely gathering. But if you can limit your interactions to folks outside of your household to a minimum, and if you are going to do something, go hang out in the yard, 6 feet apart. You know, that's better than nothing. That's better than gathering with 50,000 people. But yeah, I'm an uber cautious person. I've been actually staying in the bonus room above my garage for the past 3 weeks, just so I didn't. My kids are in daycare and school, and I couldn't be taken off the field right now. So I'm trying to get the vaccine out. So I self-quarantined away from them. I sleep much better, by the way. So yeah, you know, that's my level of risk management. That's not the same for everybody. Maybe a little much, but again, I've got a job to do, and I couldn't afford to not be here to serve the public. So that's where I'm at.
That's exactly right. All right. One last two last questions. Stephen and then Lynn. Go ahead, Stephen.
I have a question for my mother. So she signed up online and now she doesn't know what's supposed to happen. Does she get a call? Does she get an email? What does she do? Because she hadn't heard anything as of now.
When did she sign up?
A couple weeks ago, I guess, whenever it came out.
How old is she?
86.
86. Okay. You mind sharing her name over the Zoom?
No, it's June Brady.
June Brady. I will look that up, and can I call her back at a certain number?
Yeah. What is her number, Andy? Andy, you know, 859-9573.
That's it.
I'll take a look. We pulled the list on January the 2nd of everyone who signed up. And if they were 75 years or older or in that healthcare category, they got an email from me. If they didn't put an email address, they got a phone call and a text message from our Nixle system on the 2nd of January. So I'll see if the number may have been bad, maybe miskeyed. I'll see what was in there. But if she doesn't hear from us, she can call us directly at that message line, and someone will call her back, and we'll key the information in on our end.
You don't want to make her mad. She she is the nicest person in the history of the world. All right, Lynn Parsons, go ahead.
Josh, in terms of getting the word out, have you put big notices up at each of the post offices? Because I mean, that's such a place for us. I live out in Mill Spring, you know, and that bulletin board is a big deal.
A lot of gathering going on at post offices, I guess.
No, we wear our masks. We take turns going in, but still.
I'm going to say kind of sort of to that answer. We had some folks putting out our Polk Cares flyers with the message line on there. But we can update that with the vaccine information as well. We're also trying to work through our firefighters. Everyone seems to know a volunteer firefighter somewhere in their community. So we're trying to use that one as a trusted source. And the school system. So we had Aaron Green put out a special all call to all the parents, say early December-ish, maybe, letting them know about the vaccine survey and letting them know that we're working towards this. And we are looking at probably teachers, those folks who are essential workers 50 years and older, coming up here soon. That's group 1B, group phase 1B, group 2 is essential workers 50 years and older. That is coming up towards, I think, the 20th of January. So we'll be doing another vaccine clinic for those folks at Tryon International Equestrian Center. And again, if you see Sharon Decker or anybody over there, give them a big high five, because having that indoor arena is a big deal. We don't have to worry about weather. We can bring you in, get you done.
Indoor arena or outdoor arena?
Indoor arena.
Okay. Yeah.
We actually pull your car in, and we're doing groups of 30 at
It's a covered arena, but it's open air, right?
Yep, correct.
Yeah.
Covered arena. There's walls, but there's big doors you pull in, and
yeah. So
it's been great.
All right. One last question. We're almost out of our time, and that goes to Mary Sasser, who is very insistent. So go ahead, Mary.
I checked in late, and I seem to don't quite understand. If you get the vaccine, then are you immune, or you just are apt to get less symptoms?
That's a very good question, because I asked that same question last night to the state epidemiologist. So the current guidance is if you get infected with COVID-19 and you come in contact with someone, say, less than 90 days later who's positive, you do not get quarantined unless you start showing symptoms. So you were infected at one point, you came in contact with somebody who was later infected, you will not go into quarantine unless you show symptoms. So in theory, we're vaccinating you, so you should have some level of immunity to the outcomes of the virus, right? It doesn't talk about transmissibility. It talks about the COVID-19 outcomes. So the question the researchers are now looking at is transmissibility. Is that virus transmissible to somebody if someone's vaccinated? We don't have that answer yet. Our assumption would be that there will be some guidance change that as long as you're not symptomatic, I would suspect at some point they'll say you do not have to quarantine for a period of time after that vaccine. So more to come on that.
So you're saying that you could, even if you've had the vaccine, you still could get symptoms?
I'm saying we don't know if it's
transmissible.
We're not sure if it's transmissible after the vaccine. The researchers are still trying to determine, could you be a carrier, if you will, but not be symptomatic?
So we really still need to wear a mask.
Yes.
Oh, that was a great question, Mary. That was a great question. And because she asked such a great question, we're going to close out the questions on that particular note. because it is 12:56. And this has been a very involved program. I have recorded it. It's going to take a while for me to upload it to the internet. But if with your permission, Josh, I will put this on, we'll put it on YouTube and give everybody a link to it that they can look at. Is that okay with you?
I wouldn't have worn the shiny vest if I knew that was going to happen.
Well, it makes you stand out more. So, but if that's okay, I mean, I want to make, okay, good. All right. So I'm going to stop recording now.